Hit it on the dime.
Oh, there it goes.
All
right, I will open up this town meeting for, that's a council meeting. I apologize, for October 19th. Please stand for the Pledge of Allegiance.
Yeah.
That's a party.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All you, Twyla.
So we'll start with roll call. Councillor Albert?
Here.
Councillor Colby?
Here.
Councillor Garrison?
Here.
Councillor LaRochelle?
Here.
Councillor Ward?
Here.
Councillor Lunn?
Here.
And Councillor Fellows.
Here. Moving right along.
To good news and recognition.
Anybody got anything for tonight? How about the public? Anybody? Hearing no movement or sound in the room, let's move on. Public hearings.
Under public hearings, once the chair opens a public hearing, those present who wish to speak may approach the lectern and address the council chair. Please use the microphone and state your name for the record. The first public hearing is to amend Part 1, Chapter 46, Streets, Sidewalks, and Other Public Places, Article 3, Street Acceptance Standards.
Anybody wishing to speak on behalf of this item for the council, please step forward. Seeing no movement, we'll close the public hearing.
The next public hearing is to amend Part 1, Chapter 12, Ethics and Conflict of Interest, Section 12-3, Ethics Panel.
Anybody wishing to speak on behalf of this item, same. Again, I'll close the public hearing.
Next item is the audience participation and response for agenda items. At this time, those in the audience who wish to speak may approach the lectern to address items or issues that are on the agenda.
Anybody wishing to speak on anything that's on the agenda, please come forward. Moving right along, Twyla.
Under the consent agenda items are considered to be routine and will be considered for adoption by one motion with no separate discussion unless a councilor requests an item be removed for immediate discussion. Any councilor wishing to remove an item now? Order 2021-220, to approve the municipal accounts payable warrants. $803,211.73. Municipal payroll warrants, $340,918.15. The school account payable warrants for $188,486.87. The school payroll warrants for $735,458.60. And the minutes of October the 5th, 2021, and the public forum meeting minutes, October the 12th, 2021, along with the 22-24 Durham ACO contract authorizing the town manager to negotiate and execute a 3-year ACO contract with the town of Durham and to approve the mutual aid policing services agreement with the Saginaw County Sheriff's Office authorizing the town manager to sign the MOU as presented.
Make the motion.
Second. Any discussion? All in favor?
Order passed 7-0.
Next item.
Under Council Orders, Resolutions, and Ordinances, Order 2021-221, to accept Wine Time Circle in Kelly Park subdivision as a town road.
I'll move to accept that road. Second?
I'll second that.
We heard this with Mr. Kelly a couple weeks ago associated with that, so it is, well, it's not either, so it's an all in favor, right? No roll call required?
I don't believe a roll call is required, but you can if you like.
Nope. Any discussion?
No, actually, what we approved in the 221 order actually made that doable to do tonight, right? That was the last
Right.
part of that ordinance change, and
Actually, I think the wording previously
wouldn't
would
affect
allow
it.
us to do it too.
No, I'm all good.
All in favor then?
Order passed 7-0.
Next item?
Order 2021-222, to amend Part 1, Chapter 46, Streets, Sidewalks, and Other Public Places, Article 3, Street Acceptance Standards. This is the second reading, and a roll call vote is required.
Make that motion.
I need a second.
No second.
All right. As we've already heard it one time, let's go roll call.
Okay. Councillor Albert.
Yes.
Councillor Fellows.
Yes.
Councillor LaRochelle.
Yes.
Councillor Colby.
Yes.
Councillor Ward.
Yes.
Councillor Lunt.
Yes.
And Councillor Garrison.
Yes.
7 yeas, 0 nays. Order passed.
Next item, Twyla?
Order 2021-223 to amend Part 1, Chapter 12, Ethics and Conflict of Interest, Section 123-3, Ethics, no, that's Section 12-3, right?
Yep.
Typo. Ethics Panel, second reading, roll call vote required.
Make the motion.
And this-
Second.
I got the second. Again, something we heard the last meeting. Roll call, please.
Roll call. Counselor Lunt.
Yes.
Counselor Garrison.
Yes.
Counselor Colby.
Yes.
Counselor Fellows.
Yes.
Counselor Albert.
Yes.
Counselor La Rochelle.
Yes.
And Counselor Ward.
Yes.
7 yeas, 0 nays. Order passed.
Next.
Next is Order 2021-224 to set the November and December council meeting schedule to meet on November 16 and December 7.
The November 16 is because of the election, so we'll have one meeting that month, and the December 7th is the
Holiday week
swearing
here.
in of the new councilors, correct?
Yep,
The first Tuesday after that, whatever.
Right.
yep, first Tuesday after the first Monday.
Anybody have any objection to the dates? It's
Would
usually
that be the
routine.
only meeting in December, or would that?
Yeah, that would be my other question.
Yes, that was what we were proposing, the only meeting, since the other meeting would be too close to the holiday.
Right.
I'll make the motion.
I need a second for that motion.
Second. Nope, go ahead. Let Mark.
He's going to be
Oh,
sitting.
okay.
He's
Mark.
going to be sitting here. That's a good idea.
Yeah.
All right. All in favor?
We're past 7-0.
Reports. School.
Nothing new to report, as I did not attend last night.
Planning.
Planning board, several things. One of the things is the potential changes to some zoning. They've been looking at ROS2 because of some difficulties. They've been looking at the village area as well. And they wish, at some point, I'm not sure what the venue will be, to have a meeting with town council, a workshop with town council to discuss future action on zoning. There apparently are some conflicts that could be easily resolved that might also lend themselves to future planning for the town. And the other thing they did, they held a hearing, and I believe they approved the revision to the solar farm on Frost Hill Avenue, the reduction in size.
LDC.
There's a meeting tomorrow night,
That's,
which will discuss the current status of the marketing study, the parking study, and some of the visioning things that are going on,
Okay.
as well as a remote meeting policy.
Conservation Commission. Same. There'll be more in a future report from Richard. Recreation.
Top of mind comes to the scarecrow, not decoration, but scarecrow, what do they call them that?
Have a contest.
Yeah, some sort of building, scarecrow building, there we go, I couldn't get the words out. Contest coming up at the Recreation Department, and then, of course, to kind of talk more, thinking about what they're doing some wrap-up at Beaver Park and continued work at the Grazi's while we wait for the spring and hopefully see a nice gazebo out there.
County. Mark and I have a meeting tomorrow night. The budget is at the percentage that we talked about. I think it came in at 5.84, so my math was slightly off from what I projected last time, but it's
A double digit, so.
yeah,
About
it's
12%.
It's not 12. We'll take under 6, which was the goal. And it should be a rubber stamp tomorrow night. I don't expect any other action other than blessing that to send it back to the commissioners to make it binding for them to keep it at that level.
It's a lot better than 12.
Right.
And I did reach out to those communities that you asked me to.
Please, thank you. Our percentage, I saw it from Diane. I don't have it in front of me. It was originally, I want to say 56 grand, so it'll be half that amount is what our increase with the change in valuation. So at least we know that budgetary figure going into next year.
Thanks for fighting the good fight up for us, fellas.
Library?
Nothing new to report.
Water.
Nothing. They met last week, and I was unable to attend.
Kurt, anything for finance that isn't already going to be covered in your recap for tonight? Okay. I just figured a placeholder if there was. Okay. You have the floor. We're up with the finance committee.
Yes, we are.
For the record, I'm Kurt Wood, I'm the chair of the Finance Committee. It's been a long time coming, but we try to keep it simple here.
got a, before town, I want to thank the people who put this together besides the community. There was a real team effort, we should be proud of. There was, particular, Kayla did, the finance director did most of the work. She did the yeoman's work, you should be proud of her. We also had assistance from the public works director and his assistant, Ray Susi. They gave us a lot of information. The town manager was very helpful and supportive of our efforts, and we appreciate that too. And lastly, I want to thank Councilor Albert. He was there regularly and gave us encouragement and good advice. I appreciate that. I don't know what paper you have in front of you, but we have an executive summary and a narrative. Executive summary is a one-page document, and I'll just take a minute to go through it because it just summarizes where we're at, and then we can go through the options. We looked at the problem first and defined the problem. We have a budget of $575,000 for this year, revenue of $178,000. That's 31% of revenues to expense. That seemed to be the issue that we wanted to narrow that gap. We looked at other towns, 10 other towns, the average was 20%. Is this on?
It is.
Is it on? See the green light on top of it?
No,
Don't see it.
just
Maybe it's
turn
not.
that,
Just move the,
that green light, yeah.
Don't see it.
Hang on.
Technology.
I thought it was on. It sounded like it was on.
I think you're on.
No, there it is.
Button.
No.
Thank you. I didn't hear any feedback, so I thought it might not be working. When we looked at other towns, there were 10 other towns. We looked at regional towns. The average was 20%. So you're doing better at 31% than the average town already. We don't know how well you want to do, but we think 50% was the target we set. We think, based on our research of other towns, we don't think it can do much better than that. Even Topsom, Freeport, were 46, 48, and they're doing paper bags. So we don't think you'll get more than that without lots of feedback you might not want. So with that being our goal, we looked at options of ways to get there. We looked at curbside pickup, scales, paper bag, current operations, and a new transfer station. So we, as we went through those, we decided we would give all these options, even though we've sort of narrowed it in, and our recommendation is that you focus on the fee structure, the current operations. We think that's the best chance to get to 50% of those methods, but we want you to see them all because we think this report is a foundation, not simply a solution. You may need to follow up, you may not want to follow up, but we think it's a good foundational information to have. So in the narrative, we just went through that and listed those items. In curbside, for example, we looked at curbside briefly because it had a $1 million price tag. We didn't go much further because it didn't seem to be what we wanted to accomplish for you, was give you a methodology to get to 50% or something more than your current 31%. So it doesn't reduce revenue expenses, and it increases. So we think that it also put contractors out of business, and we didn't think you wanted to do that. So we looked at scales. The scales were a problem because the geometrics of the site are too limited to have a drive-in, and you're going to come back around and be tested with no weight. So it doesn't fit the site. You'd have to have a larger site to do it, or you'd have to have two scales, and you probably have to hire another person anyway. So again, we don't see the revenues being there to support the operation such that you'd get to your goal, which was 50% of revenues to expense. So we didn't get much further than looking at an initial study for that. It didn't seem to work.
Kurt?
Yep.
On that one?
Yep.
Were you looking at scaling all trash or the additional items, the bulky waste?
Well, we don't think you can send cars and trucks over pickup trucks over the scale. No one does that in the state.
Right.
I don't think it would be feasible to do that. So you couldn't measure the 4 bags of garbage I bring you each
So
week.
you would do, if we were going to do it at all, it'd be limited
Right.
to just the bulky. Is what
And we
you're
don't
saying.
think there's enough of that to make the scale cost and the operation cost work.
Okay.
The scale cost would be higher than the
Okay.
income.
Thank you.
It might be worth looking into, but we think you'd probably want to employ an engineer if you did. We looked at paper bag, and it's one that there's a lot of people look at as a solution because it has
Financially, it looks like it might work as well as any for reaching the goal. For example, Topsom right next door and Freeport are at 46%, 48% of their expenses to revenue. But we think it's controversial. We don't think most people want it in town. We don't think that it's a good idea. No one on the committee supported it. A lot of us wonder what would happen to the trash because they didn't account for the zero waste study for where's the trash go. They said it disappeared but didn't go anywhere. So there were all kinds of questions we had about paper bag, but there was a lot of, no one supported it. So we would suggest if you go there that you'd precede it with some kind of a survey because we think you find that people don't want it. And that's probably a red flag. But that's as far as we went with that. Well, we included a bunch of exhibits in this study. It's a short study, but there are 37 pages, 11 exhibits. So it's a lot of material for you. We think that's helpful too. Again, foundational stuff. We looked at current operations, and here we found more possibilities. Currently, you're charging $30 for a vehicle entrance fee and charging for fees. Half of the revenues you have are from the stickers, and the other half are from OBW and electronics and other mattresses and other things you charge for. We think in addition to the fees being increased, which we think they're elastic, the fees you charge now at $30 we think are elastic, meaning you can probably raise them up to $50 or $60. And if you did, you would meet that goal. You'd be at close to 50%. That's what we think would work. Now, we don't think everybody would love that, so you might want to think how to do that maybe in stages or something. But we think that has the best chance. We also looked at and the other fees at the transfer station we think are elastic as well. I know my brother-in-law paid $50 to get rid of a mattress, and we charged $20. So we think you can probably raise some of those fees as well, helping you get there. It's if you want to get there. Finally, we looked at the new transfer station. I suggested that because it doesn't work for scales, and there's a lot of traffic there all the time, and traffic issues that you might want to look at that. But it doesn't meet the goal of increasing fees. We think it would probably cost a lot of money. So we're not pushing it. But we suggest if you did, you probably want to hire an engineer. That's basically what we did. That's the report. I know it's been a long time coming, and certainly you can whittle some of these down to a better advice than we can give you in this time we had, but we're quite proud of the fact that we got your report at least.
When we were talking about this in the spring, you guys at the Finance Committee level met the objective we were looking for. We were looking for an update right in the October timeframe. We're sitting here tonight, so I thank everybody on the committee that's actually had an input into this process to be able to get us to here for sure.
Kayla did most of the work. She did, really. She wrote the report. She did a great job.
In living with one of the members, I know there was a lot of dialogue in that regard, too. So
yes.
It affected us. And
we met with the haulers, and that was a good night.
And that was a good meeting in that regard, as I heard the recap of that.
Yeah, we had some good. They told us they had about 750 customers altogether, like 450, 250, and 100. There were 3 of them, and they said they could take it to Auburn, for example. We suggest you consider sending them to Auburn for their garbage. That would decrease the cost and probably their operation. You send them directly there, they could do that. We asked them if they could pay at Auburn, and they said that would probably put them out of business. So we're not sure if that's true or not, but that would be something to consider, whether you send them to Auburn or some places don't take them at all, period.
Right.
So you're not required by law to take them.
So is that what the comment, Lisbon paying the tipping fees?
Yes, that was what we suggested because several other towns do it that way. So we could take them. You could set up an account.
Would it be how's it cheaper than the current arrangement where we actually dispose of it here?
We wouldn't have to haul it.
You wouldn't have to haul it.
Okay.
They'd take up space there.
So all you're paying is the tonnage at the incinerator itself.
Yeah. Yeah, labor is expensive, so you're hauling it.
So the cost for the tonnage would be the same?
Right. I assume you would have to negotiate something with the company, Auburn Incinerator, but I assume they would charge, other towns do it that way.
I would imagine that if we started to go from very low to all of a sudden a pretty marked increase to visits there, they would want to have some discussions on what we would be paying and how we would be paying it.
Right. Right.
Typically what happens in a situation like that is the town agrees to pay the tipping fees, and they send us the weigh slips, and they use the same rate as what we're currently paying.
Right.
Because it's the same trash, whether they haul it or we haul it. It's just cuts us, I mean, we're actually handling the trash when we don't need to. They could just go direct, and we don't have to deal with it.
That's what caught my attention on the idea associated with that in
Right.
that regard is if
They're absorbing some of that cost.
they're absorbing a cost that we're actually having to deal with.
Yeah,
Right.
the
So-
hauling part of it.
And keeping that in mind, if that's something that we were to, and I know we're kind of digging, we're starting to peel back some layers here, but if we were to consider doing something along those lines, then I would want us to revisit the fee schedule then to say,
Right.
if we're going to ask them to
Yes.
assume a larger burden, then we want to go ahead and make sure that we reflect that as a
Absolutely.
sort of adjustment in the fee that we'd be asking them to pay to operate here. I
There
think
were-
that only makes sense.
There were some comments from the haulers about the fees, because you don't have a graduated fee, so you charge them all $3,000. The guy that has 100 customers pays $3,000. The guy that has 450 pays $3,000. They didn't think that was very fair, but I think it's not our committee advice. We let you deal with that.
Yeah, one of the things that caught my attention too, Kurt, and one of the things that I didn't see that the committee got into, what was the impression from you folks? There's no level between residential and that commercial hauler. We go directly from $30 to $3,000. Do
Big issue.
you see us breaking that out more compartmentally?
We didn't look at it. We didn't look at it carefully. We'd be happy to follow up on any of these things you'd like us to.
No, I've just
yeah.
just giving it some thought in that regard is because, to your point, that it was pitchforks when we went to 25,
Yeah.
and then it was not any easier last year when we went to 30 associated with that. You guys, I know you're dead on when you say that we're going to hear when we go to 60 associated with it, if we're going to go in that direction. So if we could fragment out where some of this cost is getting to, it
I
might
think
be
if you
easier
went
to
at
follow
it $10 a year, you wouldn't have any trouble at all.
incrementally.
Incrementally, you wouldn't have any more. You don't get a lot of comments now, I bet, and you wouldn't get even less. I mean,
Well,
I would, as a regular user, I don't mind paying to go there $1 a week. If you get there fairly gradual, it's even
Okay.
easier.
I
Now,
think
you had chased historical percentages. We were saying we're just over 30% now.
Yes.
Is that over just that current snapshot, or what have we been over a little bit of time?
It's gone up since you increased
And
fees.
that's the point.
You
that
went
I-
from $10 to just recently to $25, and that jumped it up. So you were at like 20%. You were doing the state average. Now you've jumped it up to 31%.
Okay.
So it's
So,
those
so the
fees.
soundbite for the listening dot above our heads here is that
Yep.
it is more operational cost being covered from the people that are using the facility versus what it was
Yeah.
just 3 years ago.
Yeah, it's our impression that most of the committee felt that the taxpayers should pay, but how much exactly?
Right. Where's that
50%.
balance? Where's that
We
balance?
felt good about 50%.
Okay. And I like that you had peers that somewhere between the 30 and the 50, so we're
Yep.
either comparable to some, but
Yep.
we looking into the neighbors to the north side of us, the fact is closer to 40 to 60, 50, I mean, would be more palatable. Sorry.
No, nothing to be sorry for. Incremental increase, I think, too, would allow for us to continue to bang the drum and put the message out there for the transparency's sake of saying, so after the study, we said this would be the acceptable rate because this is where we had been back historically as expense that the town was taking on. When that started to go out of whack, we're just trying to bring it into alignment. Here's the plan we're proposing to do it. And that way, by doing so, I think every year, you're always going to have folks who get surprised and blindsided by it. But I think every year that we put that out there, and the more we can educate, the more people will understand why we're making the changes that we're making and the greater good of why we're trying to do it. So,
It's a popular service, I think.
Mrs.
Go.
I have a
don't
couple
see
of
you, but I
concerns.
can hear him, so I just want to make, go.
A couple of concerns I have is, did the committee consider incentives to recycle in the process?
I don't think so, no.
And how about equitable?
I think that what we come up with a rate, the town is doing 21% recycling or something like that. Currently, according to state reports, the town submits to the state 20% recycling. The average statewide is 30%. So I don't know if those numbers are accurate or how they get them, but those are the facts. So it may be, that even though you have mandatory recycling, there's not a full-on push to inspect things, so people get slack about that.
Yeah,
you
the
know?
way I look at it is there's really nothing in the current regulation that incentivizes me at all.
No.
I might as well throw it down the hole
Right.
as opposed to separating
Of
it.
course, there's no money to be made currently by recycling.
Right, right.
It is.
It's costing you money, so if you
Well-
drive to people to recycling currently, you would lose money at it.
I think that from what the Public Works Director had passed along
I
to us, is
understand.
that cost was, I
I'm
understand where
not
you're coming from.
about quitting recycling, though.
No,
That's
I don't
all.
think I'm about quitting recycling. I think about looking at big picture. We asked them to come back with a.
Bad time to push it.
How do we attack this as it starts to go out of control and before it gets to the point where we can't get back without making a very large and costly decision on how we're going to attack it? We still have a chance. We have a fighting chance right now to kind of steer this thing before it goes off the rails.
The other concern, I mean, quite frankly, if you were to jump the fee, double it right now, I think it's a good thing this council's not going to be here.
No, I think
That's all I
gradually.
I don't think
I-
the
personally,
recommendation would be to double it right.
We
like
didn't
this
say
second.
how you got there. We didn't want to.
bold
We didn't want to
strategy.
micromanage these things for you. We didn't want to do that. So we don't suggest how you do it. But my personal advice is, every year $10. Just add $10.
I realize you're not solving the problem for the council. You're giving
No.
options and
Yeah.
and things like that.
Yep.
I just wanted to say that my concern is recycling and equitable. Somebody
Well,
that
this would
has
help you.
18 trash bags a week is different than a person that has one.
Yeah.
Agreed.
I have a comment. But one of the things I noticed is that there's a large expense there with like construction, debris and white goods, those kind of things.
OBW.
I think from what I saw in the data, we're way too low on our fees there. So I think that's something we really need to look at, adjusting those fees to reflect the actual costs of, disposing of a refrigerator or disposing of all that construction waste that gets dumped there. So I'd like to, investigate that further.
One of the points that I would make that the PW director actually brought before us, we cover the fee. What we don't cover is the handling of the processing of that merchandise,
Labor's expensive.
the labor. Right.
And equipment.
Fern.
Again, thank you very much. I want to really give
Thank you.
kudos to the committee and everybody worked on it because this has been something that, it's been around for a long time and it's not been solved yet. So, it's just something, I think more of an understanding of a problem, not so much the idea of fixing of a problem.
I think it was a labor of love.
It was labor of love. I read through it, a lot of good information, a lot of handouts. It was very informational, even though I wasn't attending the meetings. I got a pretty good idea of the direction you were looking at. Again, that was one of my biggest concerns initially was the idea of every taxpayer has a different assumption what services are, right? And, question that I wanted really to be resolved is the idea is our trash something that's part of a service that's been offsetted by taxes, or is it actually a fee-based service? And it sounds like the assumption of the committee is actually it's a 50-50. So, maybe we ought to do a fire, ambulance, and plow in the same way. So, in front of your house, you got to pay for your section. But I'm just teasing. But it's an interesting scenario. It's one of those things where I think that need to dive in a little bit more, just because the equitable part of it. I think there needs to be some assumptions. So if someone buys a dump sticker for $60 and they're a resident and they're actually doing their own private, that's an assumption is that they're bringing in 2 to 4 bags of trash a week, not 12 to 20. And I think the commercial, if we're going to start looking at commercial, I think there's a lot more than 4 commercial providers in the town. To me, you're either a residential car that comes in with a sticker on it and with a few bags of trash, or you fit in a different category. It's unfair for 4 commercial haulers in this town, which we actually have a lot of commercial people that use it in town. On different levels. So again, it's the equitable part of it. I think it's key.
Yep.
How we go about that, I don't think we've solved that yet. is another option that someone actually has been putting out for years, is the idea of totally close it down and allow it to go somewhere else.
I don't think you should do that. It's very popular.
Yeah, it is, no question about it. But I mean, there's been a lot of discussion, which I think when we start going through this, I think we need to actually show the downfalls of what that would bring.
Yes.
You know what I mean? So I mean, the idea of we look at a new one versus the idea of just totally closing it down. And regardless how we go about, which has nothing to do with the Finance Committee, I would like to see one of the goals next year, early in the year, is coming up with a dumpster ordinance on how town handle dumpsters, because I think we're going to start seeing more and more. And I'm not picking any of us surrounding communities, but there are a lot of communities around where the entrance to everybody's driveway is a dumpster that either is nicely done or just overrun with trash and looks awful. So it's something I think we need to actually put in place, because as this gets worse, I mean, the $10 a year is actually a good idea to merge into it, but in all practicality, the $10 a year may not even keep up with the increase of cost of what our transfer station is costing us. I mean, that $10 a year may still keep us at the 30% or less, because increases yearly seem to be, especially lately, seems to be a lot more than that. And some of the reports I've seen lately, it's only going to get worse. We may be down just to even less vendors taking trash. So I'm not sure how we go about it when no one wants to take our trash anymore, but I mean, I'm not sure if our landfill is still functioning out there or not. But again, I think there's a lot of stuff we need to work out, but I do appreciate the idea of looking at it. And if we're going in with the idea that this is a 50-50, and that's an assumption or that other people can put their hands around, we just need to take those numbers and figure out how we get that 50%. I mean, and it may be the idea of a jump higher. It's just really unfair to actually push that burden on the 3 or 4 vendors to try to make up the difference right off. I mean, if we had actually done the same scenario and tripled everybody's $30 sticker, that would have been $90, right? We would already be there. I mean, so if it's one of those things we just got to look at. We just got to be fair and equitable, and how we do that, I think, is still a lot more to be discussed. You know, because again, as we've seen this year, just equipment, right? Forklifts are expensive, trucks are expensive, dump trucks are expensive, the trash haulers are fuel is expensive, so nothing's going to go down. It's just going to be an ongoing increase.
Like I said, next year, if you send the haulers to Auburn, you probably should look at the graduated fee for them, because they, you know.
Mr. Chair.
Yeah, Kurt.
Yep.
Go ahead. You guys your question first.
Well, no, if you're going to ask a question, I can go after.
No, I wanted to hit him with another task. And then
okay, good. Then
by all means.
I just want to take a moment to say thank you and thank the entire committee for all your hard work, town manager, finance director. I know this was not an easy task and not one that was taken on lightly.
Especially her.
But you guys attacked it with a whole lot of reckless abandon, and I loved every minute of seeing that, because it means that we're making an honest go of it. And to Kurt's point, it's foundational. We didn't have anything other than some scattered ideas and maybe a potential for a paper bag, but I think this is the place where if we have to look back and say, well, we started getting serious here. So hats off to all of you for all your hard work and many hours you put in. Thank you so much.
And I know that a couple of the vendors I talked to were very happy to be able to have an opportunity to come and speak.
Yes.
So, I mean, just the idea of having an ear to actually speak to and to actually put their feelings in place, I think it's important.
I would say that I appreciate your work and the committee's work as well, and I'd like the right to consult you in the future.
Don't give Don your number.
Ever. So what's next for the committee? I've lost sight of, you guys had goals for the year, and
we take over.
This kind of took over. Well, in that regard, one of the things that we appreciate, Kurt,
yes.
the fact is the Finance Committee is actually a tool for the council and the school committee to be able to weigh in on municipal topics. So I know you guys had a list for that first year, and primarily it was the education to get you up to speed on the budget. So this year, I expect that more input from you guys, if you choose to, on certain things. For instance, listening to your presentation tonight, I would love to see if you could get us for when the next municipal budget comes out, numbers on the transportation cost savings for moving this to Auburn, if they're in agreement to be able to do so, to get that input from the committee. Likewise, if we have the ability to potentially break out the fee structure from the simple per household to the commercial haulers. There's no in between. Giving some thought of what that might look like to be able to make it more palatable for variety. And the way I'd look at it is, do you got a guy that actually does it on the side, and the fact is he's doing cleanouts on the weekends or that type of stuff, or a small business that might be there 3 or 4 days out of the week. They, in theory, are generating more trash than a residence, which is typically there 1 day out of the week. So trying to break that out. And the last would be input from you guys on the OBW fee schedule. Take a stab at it. The fact is, you guys, if you know what's missing is the handling. Having it come from a bunch of people that are actually got the skill set from the finances. What do you recommend that level be? And the fact that I think that would have a lot of weight coming from people within the community rather than just us reacting at it up here on education.
Happy to look at things for you, especially fee schedules, but we don't have a lot of operational experience in the committee with some things, like garbage, for example, has been a learning curve for a lot of people.
Absolutely. And what I was approaching that is, you met the goal associated with the October. And the fact is, the budget we have, it's starting to get formulated around the February timeframe, so it can be a much more manageable pace. So ask those questions so you guys get that ability to be able to tip your toe in, to be able to make those real impacts on what the budget would look like for the coming year, if you choose to. In that regard, I don't know what the other tasks or goals of the committee are. It's my food for thought is where we know the report of where we're at now. Where do we want to be?
We briefly talked at a meeting a few months ago about looking at, I think the town manager talked to us about looking briefly about pay scales. The town doesn't currently have a pay scale for, grade and steps for non-union employees. Union employees have them, but not the non-union employees. So
let's put a pin in that one for right now.
That's something we could look at. We don't have, again, you could probably hire better skills, but we could give you some rudimentary advice, at least on that subject.
You through the finance director will get more on that sooner than later, Kurt.
I mean, that might be some up our alley.
Yeah, by all means.
A numbers thing.
And it's closer to the third party, which should be rather than staff generating this.
You probably, I bet you a lot of your employees wish you had.
Right.
Right.
No, that's a good point.
Yep.
Thank you.
Yep.
Any other questions of Kurt?
Thank you.
Appreciate everything you guys did.
Thank you.
Where are we, Twyla?
We're at Town Manager's Report.
So we have the Warrumble Mill site webpage up. If you haven't seen that.
Looks fantastic.
And then paving occurred on Ann Street today and Route 125.
Perfect.
That's all I have.
What do we got left for fall paving?
I think that was it.
Those
Everything else was done except for those two. That was the leftover money.
And that was the one we weren't sure we had the funding after we voted on it that is now set. Okay. Good.
I think we'd be remiss here if we didn't say, with the site being up, it's also a direct link, very simple, easy to use button there for any and all who want to take the survey to give input on the Warrumbo site. So if you have a moment, it doesn't take long, and even if you don't have access at your home, but somebody's good enough to show you this, or at least be able to pass it to your friends and neighbors who don't have internet access, please bring them to the library. They will be more than happy to sit you down, bring up the site, and allow you your opportunity to give some feedback and input. If that doesn't feel good and you want to do it good old-fashioned way with paper, please call the town office, and Twyla and or the town manager, Diane, will help you get set up so you can give your feedback. Thank you.
And I just wanted to say that the input is still needed on that. We're getting, so I'm told, we're getting typical response that we're getting on surveys. And we're really, really trying to get broader input. So any of you who have email lists out there, feel free to use them and send the survey out, because it doesn't take long and it's more about personal habits than it is about goals. There'll be different surveys in the future, but this one is for that purpose alone.
Free turkey for every completed survey?
No.
Wait, no, I didn't say that out loud.
The turkey shortage. What's wrong with you?
By Albert Incorporated.
Right.
Yes.
Chair, may I ask
Yes.
An LLC.
Diane, the DOT has been doing a lot of engineering work up by the high school area. Route 9. Is that a potential project going there? 'Cause
I think it's the culvert underneath, right there in the gully. There's a lot of issues with that, and that's on their radar to happen probably within the next year or two.
in the lower part,
In the
down
lower
West
part, the
Gully.
one, yeah,
That's actually
that's probably what they're doing. I don't know what else they would be doing.
yeah, because they're doing it all the way from the kind of like up in the bottom of Route 9, up around Extra Mile, all the way down. I mean, they've spent probably 4 days there in this past week doing surveying of all the drainage and stuff. But I was just curious if there was something.
Yeah, I think it's going to be related to that issue.
That is a state responsibility
It
as
is.
far as that.
Absolutely.
So when we keep fixing the culverts down bottom, the sinkholes and stuff, we can send the bills to the state on that, or no? Every
Good luck with that.
spring, we actually there's a lot of usually fall-ins and cave-ins in that area. So
Yeah, and they're
I was just
aware of
curious.
it, and they know that they need to be fixing it, so.
That's been done a long time.
Mm.
Thank you.
Next, Twyla?
Is Lisbon emergency update and discussion.
And Jim McDonald, Lisbon Emergency.
John Courts, Captain, Lisbon Emergency. For disclosure, I am a vendor to the town through Black Bear Ladder, and I'm also a employee of United Ambulance. To start the report, as I'm sure you have all heard, the vaccine mandate is causing staffing issues among healthcare facilities, and unfortunately this includes EMS. The vaccine mandate for healthcare facilities goes into effect the end of October, but the mandated deadline for EMS agencies was October 15th. Staffing in EMS was in trouble before COVID hit. It is now in crisis. This is not a local issue, but all over the state of Maine and the nation. I could read you numerous articles that have come out in Maine papers over the last month. The one that stuck out to me was the town of Waldoboro's town manager. She reported to Waldoboro town officials, quote, "We are not facing a crisis, we're in it." Some services have lost no providers due to the mandate, or only a very few. The problem is that EMS in Maine was so short-staffed before COVID and before the mandate that even losing a few providers has a negative effect. Virtually all EMS services are recruiting heavily for employees, with some giving large sign-on bonuses of up to $3,000. Other contributing factors to lack of EMS personnel are non-competitive pay, long hours, physical and mental health. Lisbon Emergency lost 3 providers directly due to the mandate and 1 indirectly. 3 of these were paramedics and 1 basic EMT. If the vaccine mandate were rescinded, we would gain these providers back. We had an emergency board meeting the end of September. At that board meeting, the officers recommended the following changes. A $2 per hour raise among all providers. This brought our payroll up to a basic EMT making $16 per hour, an advanced EMT making $18, and a paramedic making $23.50. So before this, a basic EMT was making $14 an hour. In the officer's opinion, this increase in pay will only help with a little bit with recruitment. This increase is more for retention of current and new employees. Number 2, allowing the ambulance to be staffed with a driver and 1 licensed provider. Since the towns of Lisbon and Bowdoin have been charged a stipend by Lisbon Emergency since 2018, we have staffed our ambulance with 2 licensed providers. We have in the past employed 1 driver and 1 licensed provider to staff an ambulance. This is not abnormal and is a strategy used at other ambulance services. The driver must pass background checks, be CPR certified, take an ambulance vehicle operators course. Our goal is to have the ambulance staffed with 2 licensed providers. Number 3, allow the ambulance to be staffed at the basic EMT level. Our goal is always to allow the ambulance to be staffed, to always have the ambulance staffed at the advanced life support level with an advanced EMT or paramedic. Number 4, increase the orientation budget for new providers. Basic EMT classes that were held during COVID did not allow students clinical time in the hospital or ambulance. We are finding that we need more time to train new EMTs since they have not had any real world experience. Number 5, actively recruit new EMS providers at all levels. The increase in pay and training hours raised our budget by $45,000 for this fiscal year. All these recommendations were approved by our board at the emergency meeting. We have had 100% ALS coverage this fiscal year to date, so we have not had to revert back to the basic EMT this fiscal year to date. We have never not had an ambulance coverage with 2 employees, with at least one being a licensed provider. Our October schedule is 100% filled. Our shifts are in 12-hour blocks. At this time, we have 6 shifts in November that require one provider not currently scheduled. This is more than normal, but not drastic. We anticipate these being filled as we get closer to the shifts. We currently need more EMS providers, especially at the ALS level. Again, all services are struggling for providers at this time. Lisbon Emergency's fiscal year is July 1st to June 30th. In past years, the most I can remember, and I've been working with the chief since 2013 on our preliminary budget, for revisions of our preliminary budget was 5 revisions. This year's budget we were on revision 11B. There have been numerous revisions due to the ever-changing situations in COVID, as well as unfunded mandates for procedures and equipment by Maine EMS. Lisbon Emergency held to only a $500 increase in the required stipend from the towns of Lisbon and Bowdoin for fiscal year 2021-2022. We were able to perform this by using available cash on hand to fund this year's capital improvement budget. We did not plan on a pay increase until next fiscal year. With a steep increase in pay among other employers, especially non-EMS, and the mandate, we determined at the emergency board meeting that if we did not raise our pay immediately, we would be at critical staffing levels within months. We are using cash on hand that was going to be used to pay ahead on capital improvement to fund this pay increase. We specifically were trying to use this money to lower future town stipends and accelerate the replacement of ambulance 401. Lisbon Emergency is currently in sound fiscal condition, and we do not anticipate any funding issues this fiscal year. In order to retain and recruit employees as well as fund our capital improvement plan, we will be forced to increase our stipend in fiscal year 22-23. It is unknown at this time how much, but we anticipate a minimum of $60,000 to $80,000 to the town of Lisbon. I'm sure you have all heard the news of Central Maine Medical Centers and other hospitals on diversion. One of the consequences of a hospital going on diversion is that patients will be transported by ambulance to other hospitals after they're evaluated and stabilized. Critical care diversion for Central Maine Medical Center started in the past couple of weeks. St. Mary's has been on critical care off and on over the last month. When hospitals go on normal diversion, they will still take trauma if they are a trauma center. Stroke, pediatrics, heart attacks. When they are on critical care diversion, they will not take any patients. They will accept the patient, stabilize, and transfer them to another hospital. There is no notice when a hospital goes on diversion, and there is no pattern. It can happen at any random time, especially in the last couple of weeks. There has been no communication from the hospitals to EMS agencies as to when diversions will happen in the future or reduce in frequency. Hospital diversions further reduce the amount of available ambulances in our area as more ambulances are needed for interfacility transfers and emergency calls, possibly having to transport to a further hospital. We are working with United Ambulance on a trial basis to staff one ambulance 1 to 3 times a week if we have the staff available to answer calls in Lewiston and perform transfers. The call volume available in Lewiston will pay for the cost of the ambulance, payroll, and supplies. If our primary ambulance, which will be automatic, primary ambulance will stay available in Lewiston. This is a second ambulance. If our primary ambulance is on a call, the second ambulance will stage at the Lewiston-Lisbon line. By adding this ambulance to the available calls, it will help reduce the stress on the hospitals and EMS, allowing the hospital to come off of diversion sooner, less waiting time in the ER, and have more ambulances available to answer emergency calls. Why not just staff the second ambulance exclusively for Lisbon and Bowdoin? The cost to run an 8 to 12-hour second ambulance would not be possible with our current budget or cash on hand. When the town manager and council formed the EMS committee in 2018, Rick Petrie, who was at that time the head of Atlantic Partners EMS, stated that it takes 2,500 calls to have one ambulance be profitable. Lisbon EMS budgets for 1,040 calls per year. Lisbon Emergency owns 2 ambulances. One is a 2009, the other is a 2012. In order to consistently run 2 ambulances, you need 3 ambulances. Both of our units are older, and all vehicles, even new ones, are prone to breakdown. Ambulance 401, the 2009, is scheduled for replacement in 23-24. When we replace that ambulance, we will need to make the decision to keep it as a third ambulance for a second day crew or sell it to remain status quo. The officers will be presenting our budget committee and board 2 future budgets, one to staff a second day ambulance and one to remain status quo. We will then bring these proposals to the towns to decide how they wish to proceed. EMS is a non-essential service according to the state of Maine. No town or city is under any obligation to provide EMS service to its residents. The staffing issue among EMS agencies was becoming very serious before COVID and has now reached a crisis. As an essential, non-essential service, there are no plans for help from the federal or state levels at this time. They're basically leaving it up to the towns and cities to figure it out on their own. Prior to 2018, Lisbon Emergency was half volunteer and did not charge the towns of Lisbon and Bona for EMS service. We reported to the towns that we would not be able to be a viable service without funding in the future. An EMS committee was established by the town manager and council. The decisions that were made at that time are the reason why Lisbon Emergency is in a financially sound position today and able to weather the storm. All public safety is hurting. For most of this report, I could substitute most points with fire, police, or dispatch. In an emergency, there are no timeouts, or let's start over. You bring what you have, training, personnel, and equipment. With a lack of federal and state support, the decisions that are made in this room will directly affect the outcome on an emergency scene. We are grateful for the continued support from both towns and look forward to our future working with you. I'd like to follow up with one more thing. I sent an email Saturday to Sam Hurley, who is the director of Maine EMS. In my email, I put, Mr. Hurley, I have to make a presentation to the town council on Tuesday, 10/19, on the state of our service due to losing 4 providers from the mandate. Is there anything that Maine EMS is currently working on or enacting to address the lack of EMS personnel? This is his response to my email. This is from Mr. Hurley. Concerns about staffing shortages are a long-standing problem in Maine. They existed before the pandemic and have been exacerbated by it, with healthcare workers, including EMS personnel, growing more tired as the health crisis stretches on. That said, vaccinations are the best and most effective tool to protect the lives of healthcare workers, to prevent them from inadvertently passing the virus along to those they serve, and to put the pandemic finally behind us once and for all. It is also the best way to combat staffing shortages that are driven by healthcare workers needing to isolate or quarantine as a result of having been exposed to or being infected by the virus. As is normally done when municipalities confront a staffing shortage that could potentially impact services, they must work collaboratively within their county and surrounding service area to build out mutual aid agreements and other operational mechanisms to safeguard the EMS infrastructure in their area. The role of Maine EMS and other agencies across state government is to facilitate these conversations where and when needed and to provide technical assistance to municipalities. We stand ready to assist you in reaching these agreements. Respectfully, Sam Hurley.
Question of Lisbon University.
Just want to say that it was interesting reading, if nothing else. I think you laid it out pretty well, and I think the town definitely has to hopefully get some more information and just kind of make the best options we can for the people. I mean, it's a service, the needed service, like anything else. The biggest thing is how we fix it for today, tomorrow, and upcoming years. So thank you for everything you're doing.
The one thing I will add, we're seeing the times at St. Mary's, our turnaround times at St. Mary's and Central Maine go from 15 minutes to an hour and a half. During that hour and a half, our ambulance is sitting at Central Maine. They can't answer calls. United Ambulances is sitting over there, Durham and Auburn. So people may have to wait for an ambulance. We are in, as John said, a crisis mode and getting no support from the region or the state right now.
I'm going to tip my toe in and ask the heavy question in the room. The fact that you referenced an emergency meeting in September, did the board know the impact of the decision that they made to your budget this year and what it potentially means to next year's budgetary for the stipends from the town?
Yes.
So the board actually knew that it was going to be a $45,000 increase and potentially $60,000 to $80,000 increase to the stipend to the town next year?
Yes.
Really?
It's either that or we don't have a service.
We're right back where we were 4 years ago.
It was a cliff. You can't put cliffs. I mean, EMS is run as a small business.
Right.
You have income coming in, you have expenses going out, and you're allowed a shoestring budget. When you put cliffs in front of small businesses, they cannot adapt. We were given a cliff. When we came out with our budget last year, no service in the state expected this mandate. No service in the state expected to lose 3 paramedics. You're talking, we lost 30% of our ALS staff and we were given 2 months' notice. Nobody ever expected that.
Sorry, John, I didn't mean to interrupt.
No, you're fine. You can't give cliffs, and we were given a cliff. And it doesn't matter what kind of service you are. If you're nonprofit, paid, fire EMS combined, every single EMS agency in this state is hurting right now. And the amount of hours that providers are working are sickening as far as the amount of overtime they're working.
Okay. So the next question I have would be, you state that the Lisbon emergency is in sound fiscal condition and you don't anticipate any funding issues this fiscal year. You draw on the line at this fiscal year because your next sentence is actually an assumption that we have to increase what we're actually going to be contributing locally, $60,000 to $80,000, to be able to avoid that same issue next year. Is that a fair statement?
That is a fair statement. With that being said, our per capita rate is still well below any other town.
Right.
And we will bring numbers to show that. Right now, our per capita rate is about, off the top of my head, I'm going to be wrong on this, but about $27, $29. Medcare ambulance, which covers Rumford, Mexico, other towns, is $49. We are still well below other towns per capita rate as a nonprofit EMS agency.
Mr. Chair.
So,
Go ahead.
one more, and I'll
Yeah.
give you the mic, because I think I'm probably going to do enough damage. The next piece, John, putting our head around it, is that looking at the trend over the current summer to now, with the second ambulance being able to be manned less by you as that pressure's come across with this, the mandate coming out, do you see that just increasing with staffing it in Lewiston? I'm looking at it from a Bowdoin's perspective. The fact is, what's the turnaround to get from Lewiston potentially to Bowdoin in that situation for the business partner that we're involved with?
With the second ambulance?
Yep.
We go to the town line of Sabatis and Lewiston, and then we'll just shoot right up Sabatis Street into Bowdoin. So once our first truck goes out, we move the one station at United to the town line. And at that point, that truck's covering Lewiston, Bowdoin, Lisbon.
As much as you can cover from the proximity. Okay, I got you.
This is the only way to staff that second ambulance without coming. I mean, to staff that second ambulance is an astronomical number.
Right.
Not one that you want to probably see.
And if we're staffing a truck for United, that means they don't have any trucks for mutual aid. At least we're able, if we're not on the call, to cover the calls in our own area.
And it means by us helping United in Lewiston, it's that much less waiting time. When you have the emergency, one of the things that happens in the emergency rooms, you have a lot of nursing homes in the Lewiston Auburn area. And those patients go to the hospital by ambulance, they have to leave by ambulance. When there's no ambulance available to do that transfer back to the nursing home, they stack patients up in the hallways. They don't get rooms. They stack them up in the waiting room. The more ambulances are available to get those patients out, the other part of that is emergencies. If you have, again, with Central Maine Medical Center saying they're on diversion and not able to handle these traumas, MIs, so forth, you need an ambulance to get that patient from down to Maine Med or Mass Gen. So again, this is why we need more. Before COVID, there was no excess capacity of ambulances in this area. Now it's even worse.
Thank you. tough questions for sure, so I appreciate you guys' candor. Go.
So I just wanted to make sure that I heard some things right, so I'll just ask for clarifying here. I heard you say that because of the meeting by the board to discuss how we could retain who we have in the seats, that using some money that was slated for capital improvements down the line for salary increases this year made the most financial sense to keep that staff from going away. Did I hear that right?
It was to accelerate the capital improvement. It wasn't capital improvement funds. Our capital improvement plan that was presented to the board, to this council and our board, is still in effect and not changed. Ambulance 401, the membership wants that ambulance replaced. They want it replaced immediately. We were going to try to use that funds to help do that. We did payroll instead.
So cash on hand is what you're saying.
Yes,
It's
it was
the
cash
CIP.
on hand.
Okay.
Again, to hold this year's budget at $500 on the increase of the town, we used excess money to fund this year's capital improvement. We were trying to do the same thing for next year. That money that was going to go to next year to fund next year's capital improvement to save the town's money is what's also helping to pay for the pay increase. But again, that's the other thing that's happened in a very, from the time we did our budget to this past month, what are local employers hiring at?
So you're segueing nicely where I wanted to go. And I wanted to make sure I heard you right before I went there, which is the same way uses the CIP to try to address long-term expenses. It sounds to me this has been bailing water, with a teacup for a long time with trying to fight. How do we keep competitive in a salary when we have some large competitors around us for the same resources? So what's the strategy that you've come up with now that you see that you're running into this consistently over and over again? Or is that something that the board has talked about to come up with a strategy on ways that you can increase that rate in which you pay?
The only way to increase our rate and pay is to increase the town stipends. There's no way for us to increase call volume other than maybe catching up on one of the other two areas. But now again, let's say we caught another town, we brought on a third town. Now that ambulance is less available for town of Lisbon because everybody's only paying for one ambulance. We're not paying for two. The towns are not paying for two ambulances; they're paying for one. So if we get a third town, now we're going to have that ambulance is less available to a resident of Lisbon. So it's a catch-22. Do we take on more call volume? We can. We can try to do more transfers and so forth. We could do as many transfers as you want with our first primary truck. We get about 3 calls a day for people crying for us to send our primary ambulance on a transfer. We don't send our primary ambulance on a transfer so that it's available for emergency calls for Lisbon and Bowdoin. We could send that truck all day on transfers, no problem.
No, and I hear what you're saying there. I'm thinking more about the magic number that we talked about earlier from the 2,500. And I'm not going to sit there and live there, but I'm saying that to your point, it doesn't matter if we hit the 2,500 if the expanse or the area that one truck has to cover becomes so great, and then there's no way to equitably share that cost where everybody feels like they're going to be, because more calls will end up in town here than they would in Bowdoin or whatever other dance partner we were to get.
If we took on another town, you'd probably have complaints from Lisbon residents because we're not as available as much. Yep. Let
me backtrack one more piece, then I'm going to hand off because I know others have questions too. And that is, hearing you talk about some of the challenges with the current diversions. That means we have trucks tied up for longer periods of time at places. Or, and I heard something that was interesting, I didn't know that, and that is that if somebody has to be transferred back to a nursing facility, it has to be done by ambulance only. They can't use other methods. Even if that patient is signed off, cleared, good to go, they still have to have an ambulance bring them back?
If it's a dementia patient, if it's a patient on oxygen, if the patient can't walk, they go back by ambulance. Okay. So a majority of your nursing home patients aren't going to the hospital because they feel good. I'm not being pretentious.
Sure, no, understood.
They're going back because they're sick, and they're at a nursing home, they're a long-term skilled facility, and they're going back by ambulance. And there's no ambulances available, those patients just sit. They can sit for 6-7 hours.
Okay.
And it has happened. And
Thank you.
It is happening.
It's heartbreaking, and thank you I just need the clarity around it.
When that patient's sitting in that bed, they don't take him out of that bed, they leave him in the bed, and now a Lisbon resident that we're taking in, we're waiting in the hallway for an hour, hour and a half. trying to get a bed for that patient, and that's why we need more ambulance. And with the diversions that are going on, that's why we're in the crisis. That, and I know it's really a game of chicken. It really is. The hospital, the powers that be, this is my personal opinion, I'm not talking on behalf of Lisbon Emergency right now. You have one side that said this wasn't going to happen, it wasn't going to affect anything. You had another side that said, I'm not doing it. And this is going to be the result. We're all going to find out together over the next couple of weeks what's going to happen.
Mr. Chair.
Please.
I'd just like to say I appreciate your service, and I've heard good things about the service from residents in town who've used it. However, I also want to note that despite as good as it is, the town is not a bottomless pit of money that can provide money whenever it's necessary. We have to weigh all those options, and I guess we'll have to consider what the town really wants for Lisbon Emergency or emergency services in conjunction with the money that we spend to get it. And that's a long-term thing. That's a decision we're not going to sit here and make tonight. But I do have one specific question. You dwelt a little bit in your write-up about the vaccine requirement. And you said you lost 3 people because of the vaccine requirement, and that's because of refusal to get the vaccine. It sounds like that's become a problem for you and not necessarily one you support. Is that correct?
My personal opinions, because I don't, my personal opinion, and this is the majority of everybody I talk to in EMS, we are pro-vaccine. I am vaccinated. I am pro-vaccine. I am not pro-mandate. There are things that could have been done, my personal opinion. I mean, these people, these 3 providers spent 11 months in a 12-by-8 box with COVID-positive patients, every single one of them. 12-by-8 box with a COVID patient, from here to the end of that, sitting there checking that patient in for 10, 20 minutes, whatever. They did transfers. They worked with COVID patients. There are protocols that were followed for an N95 masks, gowns, so forth, that those protocols worked. My personal opinion, we should be doing 100% masking. We should be doing testing. We could have, if we got those 4 providers back, we're good. Lisbon Emergency is good with these 4 providers back. They will come back. There is a shelf expiration on these providers. You have a lot of, especially the medics. You have skills they have to keep up. They have classes they have to keep up. These classes they pay for out of their own pocket, most of them. They have CEH hours. I believe it's 60 hours in 3 years.
72.
72 for a medic. We're 56. We're advanced EMTs. We're 56 hours. We do this. You have to do it every 3 years. It's out of your own pocket. It's out of your own time. We don't get paid for this. For those, so 56 hours a week we have to find to go get our CEUs for free. We don't get paid. Same thing with the medics. What I've seen from my friends that have gotten out of healthcare, they say they may or may not come back. Those that I've seen don't come back within a couple weeks to a couple months are done. They just, it's so much harder to get back in. So there is a shelf expiration. As far as the town paying, I have unlimited funds. I'd just like to address that really quick. We take that very seriously. We never wanted to come to the town and have stipends. And I'm not picking on this council because it's everywhere. It's in Maine. It's in nation. I don't understand for the life of me why nobody wants to pay EMS. Why they don't want to fund us. We are asking the least amount of money from the town of Lisbon out of any public safety. This is not against the town of Lisbon. We've had a great working relationship. We've had no friction with the town council. Our members are very happy with the way things are going. But I don't understand where it comes from down the line, because this is not the first or second or third time or the last time I've heard this. We have a job to do. The reason we are in this position now is not this council's fault. This council has been very proactive. But it is Maine's fault for lacking the initiative to see the problem and take care of it. And one of the problems is funding. And how do we fund these people? because we bring in income from insurance and Medicare, it seems like everybody thinks that we should be self-funded. We are asking $195,000 to provide 810 calls a year for the town of Lisbon. That is the cheapest of any department. Our ambulance, to buy a new ambulance, just an ambulance with a power load and a power stretcher, no equipment, and a cardiac monitor, you're talking $310,000. That's no equipment. And we are running 2 used ambulances that we bought on a 2009 on a wing and a prayer when we were volunteers, and the 2012 just to get us by so we wouldn't have to raise a stipend to the town.
Can I just add?
Yeah.
I just wanted to say that you're a private company,
Correct.
as opposed to part of a public company, us. The police department is public. The fire department is public. You're a private company doing the same kind of service for the town, so you should probably expect scrutiny. Within the town, we give the police department, the fire department, lots of discussion back and forth about what's needed and what's not needed. The difference is in a public company, a private company, we don't have any other way to do it but to have conversations publicly with you or at board meetings. So that's why that's the same scrutiny level that you could expect in the police department, or public works, or anything else. It's not singling you out because it's an EMS service.
No, I'm not, and we're not questioning that part of it. We welcome the scrutiny. We send the town council our profit and loss every month. We have 2 members of, we have the town finance manager and the fire chief that are on our board. If any town councilor wants any report financially, we will definitely give it to you. We have an open book policy. My comment was in general about the funding of EMS.
I realize that. I was just making that statement because that's why there is the scrutiny.
Mr. Court, I just want to make sure I got this right. You said asking for $895,000 for roughly 817 calls. Was it 817 calls?
195,000.
195,000 for 817 calls?
Yep.
Okay, thank you.
First quarter calls is at 302, and the first quarter calls for 18-19 was 275. If you look at the chart, calls in Lisbon keep going up.
The 800 I was referring to is the town of Lisbon. The number that Jim gave was combined Lisbon and Bowden.
Okay, thank you.
Any other questions of Lisbon EMS?
I have a question.
Please, Mark.
No, I think it might make sense for the finance committee to be involved with you guys and just take a look at your numbers and stuff. Just as another set of heads in the loop there, just to take a look, see if they have any other ideas. I think it would be a good idea for you guys to get together with the finance committee at some point. I don't know if they're amenable to it. I know you already work with the finance director.
Yeah, Kayla Tierney is our board's treasurer and on our board's budget committee.
Mm-hmm. And I was thinking reaching out beyond her to the finance committee that reports to us now.
It's not trash, Kurt, but is it in your wheelhouse?
Yeah.
Please.
All of our books are open.
Oh yes, yeah.
No, right on. Thank you. I apologize for interrupting. Any other questions for?
I'll just, no question. Just one more thing. We're going over some really heady stuff, and it's some really, obviously, it's a tense time. So just step back and say what we all are thinking, which is thank you and your staff for working through very tough times, long hours, with not a whole lot of anything but having to deal with a lot of these types of problems. So we'll give you that. We realize that we get a lot of work to do ahead of us, but just thank you for all the work you guys do. I think this council is committed. Some of us will be here, some of us won't be. But one thing I'm certain of is the council will be committed to trying to do the best things for the town residents and to try to make sure that things are equitable across the board. So,
What I would offer associated with that, prior to next year's budget discussion, as you guys know more, it's going to be a much larger conversation in that regard, is given that sizable increase, potentially, there'll be more questions associated with we come up with that value of that service. So what I would expect on that would be much more dialogue preparing for that with that next seated council to know where we're going to land rather than just a knee-jerk reaction to something that you guys would be presenting at a half an hour workshop kind of situation. I just don't think that's fair to you either, too. So where we were 4 years ago with that, as we come up with more, we'll keep that dialogue open with you guys.
I just thought of one more question I have.
Please.
You had talked about critical or crisis mode, and I know at the state level they've seen it and how it's impacting the different hospitals across the state. But I'm sure they have to have some sort of visibility and insight, because it sounds to me it's more critical with EMS than it might be with the hospital staffing. Or do they not have that sort of visibility that we're hearing about this level?
Maine EMS does not.
And so has it been bubbled up in any way, shape, or form to our legislators at all? Because I'm just trying to thinking phone calls
I'm
tomorrow.
hoping all you guys will make,
Yeah.
and girls will make, and women, make phone calls tomorrow, please.
Thank you.
We need it.
Susan Collins was in Lewiston and Auburn just recently associated with that, just with the healthcare part of it. She was on the news tonight, so there'll be a lot of EMS making that same concern for sure. When I'm just recognizing my peers from Lewiston and the footage that's actually playing out, it's a real issue.
Yeah, I just think that to your point about chicken, I think that it's here and it's now, and I think that some decisions are going to have to be made at the State House about whether or not there'll be a certain segment of population, to some of the science that you pointed out from earlier, so for some of the folks that you know that worked in close quarters with. I'm not going to pretend I know anything about that, but there's got to be some way to have conversations about critical folks providing services and roles when we're talking about hour and a half waits for potentially ambulances to respond to calls. That's the system's broken.
To our finance director, fire chief, and police chief, anything that you guys think of associated with that as we move forward to actually just keep this in the priority for the council. So if you've got anything that we didn't already cover tonight, please just bring it forward. I see
On your
Ryan.
6, guys.
Got something? Anything else you'd offer, Ryan?
Yeah, if you don't mind, if I say
No,
a few
please,
words.
please.
They were going to be speaking tonight.
Yep.
My name is Ryan McGee, Chief of Police, and I appreciate what the board's discussing here this evening and what John's done. He's done a great job, very well spoken, and appreciate it when I see him on calls. But they're just looking at the report that you sent in. I had read it previously, so I put something together. Curious if it was going to be touched upon. I think it's important to talk about. So, and it's really what you were just speaking about. But some of the concerns, I would say, just amongst police officers that report back to me, and they actually brought up themselves tonight, the second ambulance. So just quickly, I went back just this year to July. In July, there was 2 calls where Lisbon EMS couldn't staff a second ambulance. In August, it increased to 4. Still not a lot, but that's double the calls for emergency calls. Moving forward to September, it doubled again to 8 emergency calls that they couldn't staff a second ambulance. Now, this is second ambulance. This isn't the first call. They're staffing it just like they said, and we certainly appreciate that, the officers that are first on scene. In October, we're halfway through the month, and we're at 12 emergency calls where a second ambulance hasn't been able to be staffed. So I was sitting there, and I appreciate you saying something, Council Ward, because they are in a critical spot, and I'm seeing this across the state, and we owe it to our residents to be aware of this. So that's why I feel like I should speak up, because my officers are first on scene to these emergencies. These are emergency calls. Someone's calling 911. They didn't fall and cut their finger. These are emergency calls. We're experiencing more mental health calls and more drug calls. I've reported that numerous times in my monthly reports. Just this past weekend, we were dealing with armed people with knives, suicidal. My officers taking them into custody and bringing them to the hospital. We just Sunday night, and I won't get into the statistics, but there's 3 calls. 2 of them were handled by UAS United, and 1 from Durham. I mean, that means there was 4 calls going that evening. That means they already had an ambulance call that they were dealing with. When 3 more emergencies came in, if something happens at your household, Casey, the ambulance is responding immediately. But next minute, we got to go to Norm's house and then maybe Fern's house for emergency. This is critical, not having 2 ambulances at a minimum available in this town. And I understand what you're trying to do, because obviously you have to do things as a business as well. But we also got to think about the biggest picture here, public safety. Patient care, that's important. If I have to go to Counselor Garrison's house or something, we need to take care of him. We need to take care of his family. This is critical, because these are emergencies. Lisbon is a growing community at just under 10,000 people. This community is not the same it was when I was here 20 years ago, when I first started. It's changed, and we've had extremely violent things happen in this community. Just this year we had somebody stabbed nearly 40 times. That's serious. We have all the training in the world, but we need good medical providers on scene to assist us when emergency arises, because unfortunately we have to prepare for the unknown. And only having 1 ambulance available, and I don't know all the ins and outs as far as putting them to Lewiston or right in the town line, and they're going to have to do what they have to do. But I'm saying, for public safety aspect of it, I feel compelled to just say that we need to think a little bit bigger here, at the bigger picture, that we need to think about the safety of the community in this town, because there is a lot of people, and there's more people moving in. There's more people building in this community. There's big talks about the Rumbo site. We just really need to think big picture now, and not waiting a year from now, to make sure that at the very least right now we're taking care of who we have and what we have, because it's really important. And that's why we go to all the medical calls as long as we can. There's a lot of other calls we deal with, myself included. I go to numerous calls. I mean, just recently, correct me if I'm wrong, we just had a police officer drive a cardiac patient to the hospital, drove the ambulance. So we will step in and do anything we can to help this community, but it's important to know that this is critical right here in your own hometown, because we see it firsthand. And there's no worse feeling from someone that's been doing this, and hearing it from my officers, is when you're on a scene and you know that we don't have a second ambulance available, because minutes certainly count, and they'll be the first ones to tell you minutes count. So it's, the fire chief and I joke around a little bit, and we stay up at night, we literally do, looking for grants and whatnot. Like, wow, if we can find a public safety grant, build a public safety building, where could we put it in the middle of town? Where could be, that way we could provide the best service to the community. And we have these talks all the time, talking about how we can better the service to the community while finding grants and whatnot. So, kind of rambled on a little bit. My guys would joke with me saying, Chief, you're always talking about this and that, but this is important. So it's important to me. Public safety is really important, and what they say as far as being in crisis mode, it is so true right now. And I think we owe it to ourselves to just realize that, yes, we are in crisis mode, but we also have an obligation to, and kind of like to what Dawn said, I'm public, the fire chief's public, police department doesn't make any money. We don't, actually concealed weapons permits, but we don't make any money, but we're there to provide a service, the absolute best service we can to the community, and our officers do a great job. Our officers are dealing with the same thing that Lisbon Emergency is. There's a shortage of officers. We've been dealing with that for several months. It's across public safety, but there are ways to look into this, and there are ways to address it. There are ways to fix these problems, and I think sooner and then instead of later is the way to look at it. But if Chief LeClaire has anything to add, if anybody has any questions.
Did a good job compiling our notes. Is that what
It's my notes.
He said what he said is what I heard, right?
Yeah.
Nothing else, Nate?
Not at this time. No, unless you guys have specific questions for me.
No, I just didn't want to lose sight of you guys are on the board. You're hearing this, and anything didn't have a chance to come out. So thank you guys for framing. So
I just like to end it with thank you to Lisbon Emergency, because we are certainly fortunate to having an ambulance in this town. That certainly is a key point, because we definitely need an ambulance service, that's for sure. So thank you.
Thank you.
Thank you, Chief.
Yeah.
Excuse me.
And again, I don't want to spend any more time on this tonight, but there is and then probably if I look back at the budget, because I know Chief was just talking about the second ambulance, and what I kind of got from the first presentation, that second ambulance wasn't even going to be practical unless it was actually a subcontract type of process, right? I mean, the other ambulance being fully staffed and being used in Lewiston, I mean, that was only an option as if that was being done, right? I mean, there's really not a second ambulance fully staffed right now by the sounds of things, right?
Correct. We're doing this when we can pull together a second crew on Wednesday, Thursday, Fridays.
It's every Friday in November.
Okay, so we're going to be doing this every Friday in November. That's a heavy transfer day. It takes about 3 to 4 calls for us to make a profit. I hate to say it like that, but that's the stark reality. In order to pay for everything and make it so it's available to staff that ambulance. The payroll 24/7 for 2 providers to staff that second ambulance, we do not have anywhere near that amount of cash. We would have to have an emergency funding in order to staff that second ambulance any other time other than the reason we're doing this is we're guaranteed those calls. We are being put in rotation in Lewiston. The only way we would not receive any money is if there were no calls, and that's really not going to happen right now.
So again, just rough numbers. So if we, as a town of Lisbon, would want to actually have 2 fully staffed ambulances, no, just dollar-wise, I'm just talking about, do you even have a number of what that would cost?
No, the chief and I were supposed to work on this, start working on this.
Step 1? I mean, do you have?
We were supposed to start on step 1 at the exact time the mandate came out.
Yeah.
And we've been not doing nothing but working on the mandate ever since.
What's your total operating budget? I'm sure I can look it up for one year.
I want to say 650.
650 for what's your actual operating
$650,000, but that includes, that's everything. That's our capital improvement plan. There's nothing hidden in that number. When we present our number to the towns, it's everything. That's our capital improvement plan. That's what we need to run for the year.
Facilities, maintenance.
That's
No, I'm just listening to you, and I'm thinking, I know what you think. I think what you're hunting for.
I'm just looking at numbers. I mean, I hear Chief's requests, and I'm just thinking about the idea of, and it's what we've been heard before. I mean, there's no second about it. I mean, and from what I heard from your presentation, there isn't, even at this point, regardless, it's not a second unit. A second unit only becomes viable if you actually have a cash flow with that particular to make it happen. So
right.
I was just trying to, for people, because we hear a lot about first and second, but until people actually understand the dollar values, because we were talking about $60,000 earlier, but the real numbers of hundreds of thousands is more what we're talking about, not tens of thousands.
Oh, easily, because the other problem is that a second ambulance is not going to make that anywhere near the revenue the first one is. That first one is, we're budgeting 1,040 calls. To Chief McGee's point, we definitely missed those 12 calls. We want to hit those 12 calls, but that second ambulance is only going to run 12 calls. It's not going to run 80, 90 calls. So the revenue income for that second ambulance is going to be astronomically lower. We're splitting instead of 80 calls, now we're splitting 92 among 2 ambulances.
Yeah. No,
so it's proportionally
it's
more expensive for that second ambulance.
A lot of logistics, and I think there's a lot of stuff as a community, as Chief mentioned. There's ways to work out a lot of problems, and the biggest thing is just how we work it out. That actually is, it's not just for today, tomorrow, but long term. That's the big thing.
Chief McDonald and I are going to we're at a point now where we can start working on it probably in the next week or 2.
I hate to put you on the spot, but I want to ask this question just because we started bantering some numbers back and forth. Is there an average number that you can, when you say the 650 operating cost, is there a percentage that has the increase annually? I know it's not salaries, so we know there's no increase there right now, but just general operating expenses. Have you noticed is it 1%, 2%, 3% increase on average that you see for year over year?
So we usually figure 5%.
Okay.
On our expenses per year. This year, there's other factors, like Maine EMS is now requiring us to have in the past there was a regional medical director, so you had one emergency doctor that was the medical director for all the ambulance services. I'm a licensed EMS provider, I work under his license. We're not autonomous. Everybody in healthcare works under a doctor's license. Maine EMS has now said that every individual service will have their own medical director. So now we get to pay for that.
Who's the governing board of that? Who made that decision to
Maine
pass that?
EMS.
So they passed that down on to every
And
individual. But who does Maine EMS?
Maine EMS is the state of Maine.
No, but who do they governor ultimately? Is that where the buck
Public
stops for them?
safety, right?
Yeah, they're, Maine EMS they have their own Physicians Advisory Board, their own board, but they fall under the Maine Department of Public Safety.
Thank you. That's what I wanted to understand.
Yeah.
Wanted to understand whose case to rattle. Thank you.
Another downflow cost, right?
Well, no, I just I understand whose door to ask Mr. Timberlake and Mr. Mason to knock on.
And I'm not going to sit here and tell all the unfunded mandates, but there's a bunch more.
Yes.
I appreciate your time. Thank you for letting me throw a bunch of questions at you.
I got one more just to float it. You write me off as an uneducated insider, I guess. The evolution to here, somewhere in 1970s, you guys actually formed because of a pretty shitty situation that presented itself in Lewiston. It's what I understand. It was an offshoot associated with a bunch of local initiatives that actually decided we could do better than United locally here. Has the intention been from day one to be a subset? And if not, is it any benefit to actually considering actually bringing you under the town umbrella formally, publicly, rather than just this arrangement that you guys keep trying to shoot?
You want my personal opinion, or you want me to speak on behalf of this emergency?
No, give me yours. If it's different, then I'll let Chief. He's standing right there, too, so I'll give you guys both the option.
Yeah, I'll say my personal opinion. I'll let Chief speak. My personal opinion is you're going to have a revolt if you try to bring us under the town umbrella. There's nothing against the town personally. We have blood, sweat, and tears into our service, and we have membership. The membership votes on how to run the service. If there was friction, I'd be the first to say, no, let's go into the town if there was friction or we're mismanaged. We are not. When we went to the town, but we never really spoke of this, but back in 2018, we did a straw vote among all the members. Every single member voted they would quit if we were brought underneath the town. I would say that we could do another one if you want. I wouldn't suggest it because morale is extremely low among all EMS providers right now. We want support. I would say we'd lose at least 50 to 70%, me included.
But I think I'm not going to challenge that because in that regard, Norm and I were standing in Lisbon Elementary with you guys, and we had that conversation. The reason I'm asking that question is the fact that if it needs to be a priority underneath that public umbrella, you don't have that. You have the skin in the game because in that regard is we just went to a point where we're accepting minimum staffing at the fire for the first time associated with that. We are in a position locally that in the last 6 years, the fact is the perception of what the police department asking for has changed in this community. The fact is you want the skin in the game. The fact is I think that you have the message here that we're not a community that wants to put a price tag on public safety. So if that's the case, then I think that's potentially re-educating some of your members that we're not the enemy here. Because in that regard is we listened to you 4 years ago, and the fact is we knew the reality associated with the fact is we either have limited options or we're shuttering the doors. I'm saying the fact is if we have a membership that actually are that far against it, that's part of the problem.
I would disagree. If it was a situation where the town wants more service, we can provide that service.
Okay.
Again, we were told that this town wants one ambulance, and that's what we're doing.
Right.
We can't magically make the second ambulance appear.
Because it just doesn't financially work. Right?
Correct.
You would go down there. Right.
And we've been trying, and we get a lot of slack from the town, rightfully so, about going up on stipend because we're adding to the tax base. That being said, our payroll was some of the worst in the state, and we're trying to get that up, and we're trying to keep our stipend low, and so we can't do everything. You can have fast, cheap, or quality. You can pick two. We can't do all three. We can present.
And don't misinterpret what I'm trying to ask. I'm asking that question because if it needs to be a priority,
I think we agree. We have a current council that is very pro-public safety, which is why the investment in Lisbon Emergency has been a key piece to that, to here. But I just didn't know if it was always meant to be a private entity associated with that based on volunteers, or is it time to be able to consider public safety underneath the municipal umbrella? Because I can talk about whether it be insurance, whether it be fuel, the operating costs that you guys have as a volunteer to be able to come up with these things. We have greater capacity to be able to get into some of those dialogues that you don't. So that's why I'm just asking the devil's advocate question. Is it time to consider?
I would disagree with that.
That's fine. You've answered my question.
I would disagree in the fact that the town can do it cheaper than us or the same quality. I strongly this is my personal opinion.
That's fine. I appreciate
I strongly disagree.
Okay.
I know what's going on. I know what's going on in that place, and they are at a point. We are almost there. We spent the last 4 or 5 years trying to fix something that was broke. If the town tries to take over EMS, you are not trying to fix something that's not broken. You are trying to break something that isn't broke.
Okay, that's fair. That's fair. And I needed to hear from you, John. I don't want to armchair quarterback and actually beleaguer the point. I'm just asking because I need to hear it from somebody that's involved. Chief, go ahead. Same thing.
Two chiefs before me talked with Chief Gallipo from the fire department about merging. Chief before me talked to Gallipo about merging. I talked to Sean Gallipo about merging, and so there has been talks over the years.
Okay.
Chief Leclerc, he knows the history of Lisbon EMS pretty well.
Yeah, so to answer your question, and Bob Robitaille has the supporting documentation behind this, is when Lisbon Emergency was formed, the intent was to get the service started and provide the services as long as they could get the service established to the point when the town would take it over. And that was the original intent when the citizens started Lisbon Emergency. In the 80s, they tried giving the town wanted nothing to do with it. The discussion came up again in the 90s. Town didn't want the liability of it. And then in the early 2000s, I thought you were around, Kurt, when this went down, but Sean Gallipo was given direction from the town to start conversing with Lisbon Emergency about coming under the umbrella. A committee was formed, and when Bob Robitaille was voted out as a director of Lisbon Emergency walked away from the table. And that's what the history behind that.
Was it cause and effect? Is that why Lisbon Emergency wrote did we burn the bridge?
I don't think we burned the bridge. I think at the time the
No, Chief.
Yeah, the new service chief and the people who were there didn't want to be part of the town at that point in time.
Okay.
So they had.
Okay, that's
for whatever reason, I don't know 100% sure, but that's the timing on that one.
Okay, that's fair. Yes.
So just kind of putting everything together here so we can kind of talk it through a little bit. I think that we have a couple of things in front of us right now. One is more about a short-term issue that needs to be solved. And I say short-term, something that is very high priority and that we need to discuss and work through from a public safety perspective on how we can at least handle the here and now in the situation that we're in. And then the bigger discussion that's come up is whether there's any appetite at all to just investigate if there's even an option or if there's something that either party wants to consider right now, and fiscally does it make sense financially. So the bigger one I think should be kind of tabled it's there, and I think it should definitely come up in budget season if that's the choice. But I think for the here and now, the reason they're in front of us tonight is to make sure that we have all the facts about what's going on in their world and what we need to do to think that through and decide what we have for appetite to support at this time.
Right on. Anybody else?
All good for now.
Appreciate you guys. Thank you. Next, where are we, Twyla?
We are at E, department head written reports.
Any questions or observations on the reports? Moving right along then, 12.
There are no appointments. It's counselor communications.
Yes, I have one thing,
Please.
and it kind of happened by accident. I was watching the news, local news, just before we came here tonight, and I saw Springworks all over the local television in their affiliation with Hannaford and their not hydroponic but aquaponic growth facility. And the news spent a lot of time trying to educate the public on what the difference was, and it was good for Springworks.
Good for Lisbon.
Yeah, good for Lisbon, good for Springworks. So I
They
thought
were
I'd
on
mention that.
Saturday night too, and
They were.
in Flux as well.
That was
Yes,
a great,
yes, I saw
Yep.
that too.
great two-part. Yep, that was nice.
Anybody else? Council communications.
Yeah, I got one. So this is more of a personal note, and I just want to kind of call a shout out to Chief McGee and the entire Lisbon PD. Yesterday was my daughter's birthday. She's taken a shine to all things law enforcement as of late, and they were gracious with their time and energy and effort to give us the walkthrough, show us where everything is. Maggie got a mug shot, which was awesome. But I call it out because it's that kind of community. I'm sure it's just not just from myself. The things that we talked about yesterday and the efforts that are made to try to interact and engage with this community. Well, we got a good one in Chief. Not that it's something we didn't all know when we said come on board, but so I'm pretty excited. The patrol officers that I met yesterday, my family met, fine folks, communications folks as well. I fly through here so often we forget that they're in there doing their thing and grinding every day. So hats off to your team. They were awesome yesterday.
And yeah, just
Please.
one more thing,
Yep.
and I'm not sure, I don't want to steal any record, but it sounds like, talking to Mark today, that Halloween is going to be kind of going back to a little bit traditional at the MTM. They're going to be doing the hot dogs and events this year again. So Halloween night, I mean, that hasn't happened in a year or so. So if any information, probably the best thing is to reach out to the Recreation Department.
Monday.
Make sure that it's all happening, but it sounds like it's somewhat not getting back to normal, but trying to make something normal. So
It'd be nice to see the park full again.
that'd be a good time.
I'd also like to communicate that Chief McGee, I still want to ride. If you can come up with a time on a Friday night. I know you backed out on the other
Cuff him
one,
and
but
stuff him.
Oh.
In the back.
I will pay for the picture.
Anyone wants to ride, you just let me know. We'd love to ride.
okay.
As long as it's not torrential downpour.
See, he's got an excuse.
That was the case that night.
I know.
Nice.
Anything else? Audience participation for anything else that we didn't cover, please.
So over the weekend, I noticed that there's a grant opportunity for me to apply for, and the deadline is the 10th of November, so I won't be able to get to the next council meeting. But the Firehouse Subs grant is currently open, and I'd like permission to apply for it and accept if received, to apply for that grant to finish replacing our hydraulic equipment that we started replacing a few years ago. It's currently in the CIP for next year, but here's an opportunity for me to try to get ahead of that and finish completing that project, which right now is looking at like a $26,000 project to complete.
I'll take a motion.
Make that motion.
I need a second. Any other discussion on that item?
Is that a straight up grant? Is that a
Straight up
match?
grant, there's no match.
Sweet.
Yes, those are the best ones, aren't
No,
they?
that's good. It's the heavy question. All in favor?
7-0, order passed.
Go get that money, Chief.
Yeah, thank
Yes,
you.
please.
Can I ask one question?
No,
Hey,
Chief.
Chief, just a second.
Sure.
And if possible, I mean, it's always entertaining reading our, quarterly reports, monthly reports. It's always good.
Yep.
Since we actually know we have a new full-time employee, is there any way that we can add a section in there just to just keep the council abreast of what's being done with the new employee, what activities being done?
Yeah.
That'd be great. Just as we move forward in the budget, I don't think it's going to be a contracting, but more of an expanding situation. So it's always good to be able to actually put some dialogue behind what the operations are and what's being done.
So I'll give you a quick overview of what he has been doing right now. And right off the very beginning is just learning. He's learning our stuff, our policies in our town. That's basically what he's been doing. He's been spending a lot of time with Captain Eric Watson just learning our equipment. Because it's a little, we do things a little differently. Our things are a little different than the other communities he's worked in, so he has to learn some new procedures and some processes. For example, our compressor foam systems that we have in town. And he's been hitting the ground running as far as trying to get the stations cleaned up and getting a lot of the excess mess that's been piling up from lack of people in the stations to take care of that. So that's what he's been working on just since he started.
And may I ask another question, Chair?
Absolutely.
He does have, other than fire, he has the EMT also, right?
Yeah, that was one of the requirements that we put down on the applicant was to hold a valid EMS license.
So the discussion we had tonight, how many calls, if Chief is actually at a call, I mean, do you have a certain criteria of calls he'll be responding to? If there's not, does he respond to all calls, or is it, when it comes to emergency call, there's not a second unit available and there's a long wait time, we're waiting for Durham to come over?
Right.
Is he actually
So-
actively going to emergency calls at this point for?
Yes.
Okay.
Yeah. So how we're talking EMS, when we first started doing EMS related calls, I think it's about 6 years ago now, it was set up with Lisbon Emergency's input and how we respond on those calls. The first and foremost was situations when they're not available to go. We'll respond. So at least get a provider on scene, provide care until the ambulance from out of town shows up. We also get dispatched on those high priority calls, the stabbings, the shootings, thankfully not a lot of those, the possible cardiac arrest, unresponsive, those high priority calls. Those are labor intensive calls, require multiple people, so we're dispatched to those and go along with those as well. So those are the calls that we go on, and Chief McGee mentioned how many calls that they haven't been able to respond on since July 1st. I ran the numbers earlier today, and we've gone to 27 calls dispatched for first responder calls since July 1st, and some of those are in conjunction with Lisbon Emergency.
I guess my point for asking is, I mean, the cameras tonight's seen a lot of information in crisis, right? But with part of this budget, bringing on another full-time personnel that is available, we actually have done the best we can to try to actually reduce that crisis, right? By someone that's a paid staff during the day.
Yeah,
that's again 5 days. It's a 40-hour work week, but it's just one of those things where, we are working in other avenues to try to actually have a response for the safety in town. So.
And where it's really helpful is it gives me the opportunity to try to get some other things done. Or if I have to run out of town if I have to run to Lewiston, run to Brunswick, run to Portland or Augusta, whether I'm picking up supplies or having to go to a meeting, I don't feel guilty about leaving town because there's somebody in town that can handle whether it's a call or whether it's dealing with a burning complaint or something along those lines where someone calls, has one check, to have somebody I know is around to handle those complaints.
Yep, I think it'd just be good on the reports for us to be able to get a better idea of what he's responding to, and as this crisis keeps going on, if we see that actually being a avenue that's used more often, then we can react to it. But unless we actually see that on paper, sometimes it's hard to, unless you're up front presenting, it's really hard to know that. So.
It's really hard for the fire service in Maine because the fire service is that one entity of the public safety that we don't answer to any state agency. EMS answers to Maine EMS. Law enforcement answers to the Criminal Justice Academy through public safety. The only regulations we follow are the OSHA regulations. We don't have an agency, state of Maine, that we report to. So there is everybody knows there's a crisis in volunteers or firefighters in the state of Maine, but nobody knows the true numbers because there's no database. We don't know how many firefighters in the state of Maine today versus 5 years ago versus 10 years ago. Nobody knows because there's no database or anything that we answer to the state of Maine.
Things keep continuing the way they are. You will know because.
Oh, I know in house. I know in house right now. It's getting scary. I'm looking at a handful of people right now that are long-term members that I know. I'm watching the calendar. I'm watching the clock. It's only a matter of time before I lose them, just because it's becoming that time.
Yeah. No. Good. I appreciate the information. I think it's important for us as a council to actually just know what our assets are how they're being used, and I mean, any asset that's being overworked, we know we need to expand on. So I mean, and we do appreciate everything that the ambulance service does, but we want to just make sure that we're able to take care. I mean, it's nothing worse than having a police officer at a scene, an accident somewhere, and it's the idea where you cross lines, where you change uniforms and start performing something different. That's pretty challenging, right? I mean, there's a lot of stuff going on, and it's, to me, it just gets dangerous for people, because unfortunately, it's not just for the citizens, but for our people also. What they put in, sometimes put situations they put in that they have to deal with. That's all.
And just to add to that, my point on the calls was this trend since July, each month is doubling the amount of calls that we don't have an ambulance to go to. And it is good. Glenn's awesome guy. That he's top notch. You can ask him. I was on the World Board. I try to steal him for the police department. And he's good, but we still don't have an ambulance to be able to transport if he's the one.
Oh, absolutely. No, I hear the ambulance come over the hill from Durham more often now than I ever have. I mean,
So I just wanted to make that point, and that's all as far as like the doubling of calls each month. Just so you're aware of it, and have all the data in front of you. That's important.
Good to know.
Thank you, gentlemen.
Anybody else for audience participation? I hoped you were coming up because you look like you were lunging forward.
Well, Ryan McGee, Chief of Police. I just have one thing to add, not on that topic, unless you have any questions for me. But Harvest Festival is coming up, so that's going to be on the 30th from 3 to 5 down at MTM Center. I welcome everybody to be there. I'll be there, and I'll have some officers there, and we'll have a cruiser for the kids to climb in and out. And we're going to be presenting 3 awards to kids for this pie eating contest. So I'd love to see everybody there to participate in it.
But you're not doing it, though, right?
You have to show up to find out. But I do have an award for first place for each child that gets.
I know who's doing it, so no.
But I do have an award for each child that wins. So we got 3 awards to give to the kids for a free cruiser ride to school, or we'll let them choose the cruiser or the Humvee to go to school. So that'd be kind of neat. And there'll be some events there, so I hope to see a lot of people from the community. And also for Halloween night, Dare this year, we got glow sticks for several hundred, actually, 600 glow sticks. A lot of times our officers, most of us work Halloween night, come across kids that you just cannot see. And so we decided glow sticks was what we're going to do. So the officers, if you see an officer, if there's any kids listening or parents listening, we got glow sticks to give out to the kids, and the officers will be stopping any kids that you can't really see or don't have any lights or whatnot. We'll be giving out glow sticks to kind of increase our community policing and outreach and whatnot, and keep kids safe. So that's all I just wanted to add.
Thank you.
Thank you, Chief.
Anybody else? Next item, Paul.
Is executive session. So order 2021-225 to go into executive session per 1 MRSA, section 405, 6A, personnel matters, and 6E, consultations with legal counsel.
Neither will put us back here?
Nope.
No other action, right?
No.
Make a motion.
You guys are dismissed.
I'll second.
Second by Fern.
Chiefs, hold on for a second.
Vote. Order passed 7-0. Then I'll turn off the cameras.
Good. I didn't vote.
Yes.
I didn't vote.
That's all right.
Yeah, Twyla counted me without me even having my hand up. I see how it is.
You abstained.
I was going to abstain. What's that?
Oh, yeah.
I vote no. I vote no on adjournment. It never works.
Yeah, I know. I was going to vote no. I don't want to leave.
Stay here until you
Yeah.
vote yes.
Oh, I got to work in the morning.